We just recently recorded an episode on incontinence and about how you try to not pee and sometimes it comes out. So what can we talk about when it comes to stronger bones?
Oh my gosh. I mean, I grew up with my mom who would go like this. Sit hard. Your posture is terrible. You stooped over. So that always reminds me of osteoporosis, is because my mom would just go on and on for years. Even now, she's 85, and she'll just, you're not old. Why can't you stand straight?
You know, when you do that, you're giving me a vertebral compression fracture, right? Because I am menopausal now, and so I could get a fracture from that. Just saying.
Hit harder.
Well, maybe you should drink more milk, like our parents always used to say.
That is true, actually.
Why are you drinking milk?
You're right. We don't drink milk like we used to, not in the olden days.
Yeah.
So are we going to be talking about the benefits of milk, or should we talk about osteoporosis? Today's episode on Avaaz is about osteoporosis, stronger bones, stronger body, and what we can do about osteoporosis when we are in this age demographic where it's more likely to happen than when we're younger. So first of all, let's get into a definition. What is osteoporosis?
Osteoporosis is a condition in which bones become weak and brittle and are more likely to fracture. As you know, bones are living tissue, and the body continuously replaces old bone with new bone. And as you age, your bone density decreases because your body can't keep up with how quickly the bone is being replaced. And after age 30, it's quite natural for the bone density to start to decrease. To put it in layman's terms, think about it like a bank account. When you're young, you're depositing bone, you're depositing into it, and you're not making as much withdrawals. And then things switch up around the age of 30, where you're taking out more than you're depositing. And it's this deficit that's osteoporosis. Another word you might have heard of is something called osteopenia. And there's some confusion between the two terms. Osteopenia means thin bone or weak bone, but it's not as weak as osteoporosis. So it's a stage where the bones are thinner than normal, but not so thin that they will break. And once bone density decreases further from the osteopenic stage, that's when we call it osteoporosis. And the way that your doctors will medically diagnose is based on three different things that they can use. One is if you have a fragility fracture, and that refers to a fracture that occurs from a pretty trivial fall or incident, usually from below your height, and most commonly involving bones of your back, hips, your wrist, common one, your arm or your humerus, and your pelvis. Those are common places for fragility fractures to occur. Doctors can also check if you have osteoporosis by doing what's called a bone mineral density scan or a BMD scan. The other popular term is DEXA scan, which describes what it actually is, which is dual energy X-ray absorptiometry. That's a mouthful. But basically, it measures the density of a particular bone. It measures the amount of calcium and other minerals that are in a particular bone. And it gives you, it can diagnose osteoporosis and also give you a risk, a rating for fracture in the future as well. And then there's a fracture risk score that doctors can calculate based on the bone mineral density scan and also based on some clinical factors as well.
Okay, so that's a lot of medical information to take in for a non-doctor. So there's, what I'm understanding is there's osteoporosis is where your bones weaken.
To the point that they can break.
To the point that they can break. And then the other one was osteopenia, and that's where you have thin bones, but they're not likely to break.
They're not at that stage, but if you allow them to continue on that path, you will eventually end up with osteoporosis. So osteopenia is a good time to do something about it. Okay. It's always a good time to do something about it, but it can be very effective.
Are you born with osteopenia, like with smaller bones or skinnier bones?
Well, it's interesting you should ask that. So people that have a thinner frame or are underweight actually do have less bone density than people who have a bigger frame or who are have a higher weight as well.
Okay.
So certain ethnicities are more likely to have osteopenia or osteoporosis.
Okay. Why does it matter, your bone density?
Well, it matters because osteoporosis implies that your bones are weak And when your bones are weak, as Dr. Jyoti mentioned, they are more prone to getting fractured. And if you fracture your bones, for example, your back or your hip or your wrist, then that can lead to loss of mobility. And then that leads to loss of independence. And that's a big deal. So I can't tell you the number of times in a single shift in the ER that I see a woman coming in with a fracture, whether it's an elderly person who's fallen, like basically just from standing height, and she's broken her hip or her pelvis, or someone that's just developed back pain, and you do an x-ray and they've got this vertebral compression fracture, or they've fallen on their wrist because they've slipped on ice or they've tripped on a step and they've put their hand out and they've developed a fracture of their wrist. Each and every one of those causes loss of mobility. They can't use that arm, they can't use that leg, they're bedridden in some of these cases, their pain is so bad, or they need surgery, and that actually leads to them then being admitted to hospital, which leads to further deterioration, which leads to other complications like pneumonia or blood clots. And so it's just like a vicious circle that basically takes someone from being completely independent to then possibly requiring long-term care. So it's not something to be taken lightly. Osteoporosis can be quite damaging to our bodies as well as our psyches. So that's one thing. It is more common as we get older, for sure. So menopause plays a big part in it. So before the age of, like up until the age of 40, it's not so bad. But from age 40 onwards, I'd say that stats show 10% of women have osteoporosis. And then as we go through menopause, it goes even higher. So more than 20% of us will have osteoporosis after we hit menopause.
That's a significant number.
Yeah, 1 in 5.
Especially with all the other associated things that can happen with it.
Dr. Jyoti, you mentioned all these various bones that are more likely to break with an osteoporosis diagnosis than others. Okay, this is my personal question. In my 40s, I fell off of a, I don't know, like a 3-foot surface, and I broke my ankle. Do you think that because I was in my 40s and because the fall was not, taller than my head, that it could be because of weakened bones?
There could be a correlation. The younger you are, the more traumatic the fall, the less likely it is. But one of the risk factors for developing osteoporosis is a history of previous fractures.
That was my first one, and hopefully my last one. Thank you for that. I appreciate it. Dr. Madhu, what are some of the signs or some of the symptoms that a person may have osteoporosis?
Well, it's interesting because in osteoporosis, there's no real symptoms of it. So you get the symptom after you've sort of had a fracture. So as Dr. Jyothi's already alluded and talked about, is if you sort of have a very minor incident and you've like broken your leg from that, or you're just standing and you fall and you have a pelvic fracture. I have some elderly patient recently who was admitted to the hospital for that, or a hip fracture. So it's very easily can fracture your bone. So that is one sign. The other sign is like back pain. So I have elderly patients, and Dr. Nav said in Emerge, people come and they'll say they have back pain. And you do an x-ray, and very often in the lower vertebrae, the lumbar area, it can happen in the thoracic as well, I see it. You'll see what they call a compression fracture. So you don't really need to do anything to get one. It is what it is. Your bones, as Dr. Jyoti has told you, get less and less dense, so they're not as strong. They can't almost bear the weight, and it compresses on itself. So if you have a nice big square like this, and that's your vertebrae, and it goes and it just compresses, and that's called a compression fracture, and that causes the pain. So that's another sign. The third sign is losing your height. So you might feel like you're a bit shorter, like you used to be 5'5", and now you're 5'4.5". And so you can lose half an inch or an inch, and it's just by your bones sort of just compressing down with less density. And finally, going back to my mom, the stooped over posture, that hunchback. So that is another sign of osteoporosis and decreasing bone density. So those are probably the 4 things. But in terms of is there like a precursor sign or symptom? Not really, that we can tell that we have it.
So you're saying that it's not because Nyana Nikasadita, it's actually
husband Nikasadita.
How strange though, you can get a compression fracture by doing nothing out of the ordinary.
Yeah, but
Dr. Jeethi, at what age should we be considering getting this bone scan done?
So the bone mineral density scan, or the DEXA scan that we talked about, is the gold standard for diagnosing osteopenia or osteoporosis. Really, all women over the age of 65 should speak to their primary care provider about getting their bone mineral density checked. And if you're under the age of 65, there are certain risk factors that make it more likely, and you may require a bone mineral density scan earlier. And we alluded to a couple already. We talked about having a low weight or a thin frame, so a weight less than 127 pounds, or a history of previous fracture. And then there's other things, like people can be on various medications, especially steroids, which increases your risk for developing osteoporosis. If you are a current smoker or you drink alcohol excessively, if you have a parental history of hip fracture, so there may be some genetic component to this as well. And then there's the thing that Dr. Knapp talked about, which is estrogen deficiency. So if you are undergoing menopause at an earlier age, or premature menopause before the age of 45. And certain medical conditions can also place you at increased risk. And that has to do with how much intake of calcium and vitamin D you're getting. So things that affect your bowels, inflammatory bowel disease, celiac disease, chronic liver disease, all of those things can be risk factors for osteoporosis as well.
Okay. And then how do we prevent it, or how do we manage osteoporosis? Is it by drinking a glass of milk a day?
Well, that's part of it. I mean, there's a lot of lifestyle modifications that we can advise our patients to do. First off is diet. So diet, part of that, first of all, is to just make sure that you're getting enough calories in so that you're not malnourished, because malnourishment does lead to osteoporosis and thinner bones. So make sure you're getting enough calories in. Secondly, make sure you're getting adequate amount of vitamin D and calcium in your diet. And we mentioned vitamin D because vitamin D is an essential part of what we need to actually absorb the calcium when we take in calcium. And a good sort of frame of reference for how much calcium you should be aiming for per day is 1,200 milligrams. And for vitamin D, it's anywhere from 800 to 1,000 units per day is what we should be trying to get. And how do we get that into our bodies? Through food. So mostly through dairy products. So like, for example, a glass of milk will get you 300 milligrams of calcium. A cup of yogurt will do the same thing. If you have orange juice that's been fortified with calcium, a cup of that will also give you 300 milligrams of calcium. So there are ways of getting it in your diet. But there are many of our listeners who are following a plant-based diet. They don't eat any dairy, or they may be intolerant of lactose since they can't have any dairy. And for those people, yes, there are fortified milk products like soy milk, and almond milk often comes fortified with calcium. And of course, green leafy vegetables like kale and spinach will also be a good dietary source. So that's sort of the food aspect of it, of how you can help to prevent osteoporosis. In addition to that, sun exposure. And I know in the past we've harped on like not getting sun exposure because it's, you don't want to damage your skin and cause cancer. But a certain amount of sun exposure is essential because that's how we get vitamin D. And especially for those of us who no longer live in countries where there's a lot of sun available to us, we may have to supplement that in the form of supplements, which we'll talk about in a little bit.
And another thing that has been, constant in all of our podcasts is exercise. So again, exercise is so important. I think what I do want to start by emphasizing is pick something you like, because once we stop exercising, the effects of the exercise wear off very quickly. So choose something you like. So when I'm talking about exercise, I am talking about moving your body, doing a brisk walk, a run, a jog, playing pickleball, walking with your friends, whatever you enjoy. But really what's an essential part of the osteoporosis exercising is weight bearing. So what we do when we do weight bearing exercises is we're trying to increase the density of the bone. So we're trying to say, okay, we need to do some exercises by which our muscles can increase mass, our bone density is better. So doing weight bearing exercises, and you don't have to pick up huge weights. It can be very light weights or your own body weight. So doing things like that. And also just resistance training. So even using bands, stretches, anything that's sort of strengthening your muscles, your bones, and keeping your cardiovascular fitness up. Ideally, about 30 minutes every day is ideal. And of the exercise days that you do, 2 to 3 days at least should be with muscle trainings where you are training those muscles.
I think a lot of women in our community may not, actively know about some of those exercises. So it's, you can, if you go to a community gym, you can ask your friends what they do. You can talk to your kids. Because I guarantee your kids are doing resistance training and weight training.
Yeah.
So there's a lot of good resources out there that you can
Well,
use.
I have to tell you a funny story I just heard today. So my friend who's also in our age group, so her son finished university and he was working. Now he's moved back home, which is very common. And so on Monday, he waits till she gets home so that they can go to the gym together.
Aww.
So this Monday, she's like, I wished he would just left. And he got home and he's standing there. Let's go, Mom.
That's so cute.
And she's like, okay, I'll come with you. And she goes, it's really cute. I literally just talked to her today, and he will teach her how to use, Mom, you need to do this on this machine. And it's really cute. And I do think it's a great way to bond with your kids too. But if you can just go and not stress out, like no one knows what they're doing in the gym. People who think they know what they're doing, no one knows. Just go and do it. Nothing will happen.
And it's a great idea to go with your child. I did the same thing with my mom.
Yeah.
I took her to the gym because I know for myself that gym can be a scary place. Yeah. So I took her with me, and I actually had her work with the trainer and go through some easy exercises. And now she's incorporated that into her daily routine. And I found she doesn't live with me, so she lives far away. So I looked into community programs for falls prevention. And there are many free programs that are available to the elderly for regular fitness training, including weight-bearing exercise 2 or 3 times a week. And it's just a matter of looking and looking it up and Googling it.
And also one thing we're all talking about is balance, how to keep your balance. So doing yoga. So I'll tell you something silly that I do. So this is my attempt at keeping young. So when I put my pants on, so silly, I'll try to make sure I stand on one leg for as long as I can, and then put it in, and then the other. And it's probably the dumbest thing, but I feel like I'm anti-aging.
Can we get that on video? Like, can we put that on video for our podcast listeners?
No.
Actually, you're supposed to do the same thing with your shoes. You're supposed to just not lean on anything and try to put your shoes on.
Yeah.
I've also started doing it while brushing my teeth. Lifting one leg up just recently because I'm afraid of this whole falls thing.
But I'm going to go back to the going to the gym, and I do think it's really important though to understand how to use the machines, or you are likely to
you don't want to injure yourself, but don't be afraid to ask.
Of course,
that's what I'm saying. There's always
staff
someone in
there,
a gym,
or someone that looks like they know what they're doing.
And there's younger now in the South Asian community. There's also younger trainers now, and one of my patients is just starting this, and he's very passionate about training since he was like 10, and now he's in his 20s. And he's starting it just for South Asian women.
Perfect.
And at a very, very cheap rate. And I'm like, how can you do that? He goes, Auntie, I just want our women to be healthy. He goes, I see it in my mom. And so I'm like, wow, that's great. I go, tell me more when it gets going.
Yeah, it's perfect.
The other thing is things that we can do is avoid heavy use of alcohol and do not smoke. As Dr. Jeethi said, cigarettes are probably one of the worst things actually in every aspect of our health. So that's 2 more things.
And we talked a little bit, we mentioned supplements. So not all women have to be on supplements. So if you get enough calcium in your diet, you don't have to supplement with more calcium. And I actually went to my primary care provider and asked them, well, how do I know how much calcium is enough? And there's actually many calcium dietary calcium scores on the internet, including on osteoporosis.ca, where you can calculate based on what your regular diet is, how much calcium roughly you're taking in a day. And then you can subtract that from the 1,200 that you need per day and then figure out, do you need a supplement? And if you need a supplement, maybe you only need a 500 milligram supplement and not a 1,000 milligram supplement, because it's also not a good idea to take in too much calcium either. And vitamin D is a little bit trickier in terms of getting enough in your diet. So some people will take a vitamin D supplement around 800 to 1,000 units.
Yeah. I think what's happening now is everyone's very interested in their vitamin D levels. So from my experience as a professional, first of all, where we live, if you're over 19 or 18, I don't remember what the cutoff is, unless there's a special reason for you to have to check your vitamin D, you are charged about $70 to $80. I don't remember what it is. So a lot of people don't want to get it done. The ones who do, I would have to say the majority, the vitamin D is low. So it's interesting.
That's what I tell my patients. I say we live in a rainforest.
I go just take it.
Most people in British Columbia, their vitamin D level will be on the lower side.
Especially if you're South Asian too.
Yeah. So that's what my personal experience from my pool of patients is.
Just so everyone knows, I take 2,500 milligrams a day.
So do I.
I take 1,000.
Well, aren't you special?
I take a multivitamin, so whatever it gives me is what I take.
There you go.
Oh, I ran out of mine. I gotta get somewhere. Okay. Anyways, we digress.
So what else can you do to try to prevent some of this or treat osteoporosis?
So you can get the DEXA scan that we mentioned. So if you're over the age of 65 in Canada and you have risk factors or you're worried about your risk factors, you can ask your primary care provider to refer you for this bone density scan. And it basically is a measure of your bone health. And you can use it as a guide to determine how your progress is based on your modifications.
And a lot of women that are in perimenopause or menopause will do hormone replacement therapy. Does that help in replacing some of the calcium you may lose during menopause?
So that's a really good point. Menopause, as we've talked about, does tend to accelerate bone loss. Estrogen plays a huge part in our bone health. So when we start to go low in estrogen at the time of menopause, that's why women are more prone to osteoporosis then. So if you're taking hormone replacement therapy to treat your other menopause symptoms like hot flashes or lack of sleep or mood changes or the various, multiple issues that we get when we go through menopause, then yes, it's great because it also helps you to delay that onset of osteoporosis or prevent it. But it's not really a primary way of treating osteoporosis. It's more like it's a secondary benefit to taking the hormone therapy. As opposed to, there are a class of medications called bisphosphonates, which are used specifically for managing osteoporosis. And this class of drugs is what helps us slow down the loss of bone, or loss of calcium, from our bones over time. And these are medications, their names might be familiar to you, like alendronate or risedronate, and you take them by mouth once a week.
We talked a little bit already about fall prevention, because if you do fall and your bones are weaker, you're more likely to have fractures. And then it's not just your own body that has to heal from it, but then you've got caregivers that need to come in and take care of you as well. So it could be a whole family affair. And if you live on your own, that could be even a more difficult situation for you to be in.
Yeah, sometimes it's a matter of just like going through your house to see if are there tripping hazards, are there reasons that you might fall, like loose rugs, like having a bar by the toilets to help you get on and off the toilet easier, or a bar on the shower so you don't fall when you're slipping, when you're getting in and out of the shower. So doing things like that to see what you can do to prevent falls in the first place.
Yeah, I mean, it's just easier to fall as you get older, right? It just is.
So one of the things we do on the Avaaz podcast is we talk about how these health issues are relevant to the South Asian community, in particular South Asian women. So like all the other episodes where we talked about various health concerns, how is osteoporosis affecting South Asians more than the rest of the community?
I'll start with that. There is a genetic component. So South Asian women tend to have smaller frames, and as Dr. Deepthi said, that is a risk factor for osteoporosis. They also tend to have decreased bone density. The bones are not as dense as Caucasian counterparts. They also tend to have more osteoporotic fractures at an earlier age. And that's probably with all the two factors I mentioned before, and also menopause hits earlier in South Asian women. So all these genetic sort of factors lead to us being at a bit of a higher risk for osteoporosis.
So the genetics are a problem, but our diet is also a problem as well. South Asian diets are typically lacking in calcium and in vitamin D. And it's interesting, I wasn't aware of this. I knew there was an increased risk of lactose intolerance in our community. However, some studies cite it's as high as 60 to 80%. So there's a lot of people that are avoiding dairy products, which is an important source of calcium. And in addition to that, we tend to have a diet very rich in grains. But we don't know, are the grains that you're buying, are they fortified with vitamin D? Do they have enough calcium? Those are things to check. And then many South Asians are also vegetarians, which makes it even more challenging to make sure you're getting enough calcium, enough protein in your diet. So you need to look carefully at your diet if you're South Asian, and particularly if you're vegetarian. You may want to consider increasing the amount of tofu or paneer, the amount of leafy green vegetables, and using fortified grains.
So check the labels on the grains that you purchase.
Yeah, and
that's a great idea, actually.
Yeah. And, we'll talk again about vitamin D deficiency. So just being aware of it, knowing that we might not be able to get enough vitamin D just from our environment in less sunny countries. But even in India, like they get plenty of sun, but women are just taught to dress more modestly. Like nobody walks around in shorts and tank tops, right? So you're still not getting the vitamin D that you need, even in the countries where it might be more available to you. So consider supplements.
And so what you're saying then is if you're going to go outside to get some vitamin D, you should have exposed skin.
Mm-hmm. You should wear your chiffon sari like Ajal in the good old days. The other thing is, as South Asians, we do tend to, especially women, have a sedentary lifestyle. So I think it's so important to exercise, to move, and not normalize just sitting around. So maybe when you are with your friends, instead of sitting and having cha da cup, go for a walk. So you can still have your gup shop, but you just go for a walk, do something more active. And as Dr. Jeethi mentioned, look into community resources. I know in our communities, we have seniors centers, and in the senior centers, they do things like yoga classes and dancing. And I think anything where you're moving your body and doing some exercises, they have community centers where they do have exercises for the elderly and yoga classes, balance classes, fall prevention exercises. I think it's really important. So we do need to normalize this conversation that instead of just sitting at home, and women do tend to put themselves on the back burners as well, like they'll take care of everyone in the house and then they're sort of at the end. I think it's important. Exercise with your kids, with your husband, go for walks with your friends. So try to make it a normal part of your routine.
So what we've been hearing around the room is that there are things that affect us all when it comes to osteoporosis. So some of the myths that we've heard, I think you guys have mentioned this before in conversation, is that osteoporosis only affects you during menopause, and after menopause you can't do anything about it. But that's not true. You can fix or at least strengthen your bones after menopause. Other people think that you have to be an older person, because you hear about older women or older people breaking their hips from a little fall. But no, it doesn't happen to just older people. So you can get, if you're having fractures earlier in age, you can get checked out as well. And the other thing is that we've heard, which is totally a myth, is that calcium will fix it all. It won't. We've talked about how you need calcium, how you need to have vitamin D, how you have to actually get tested to know if your bone density is going to keep you going, and what you can do to strengthen it. So I think everybody just really needs to know that you can help yourself. You can strengthen your bones so that you're not weaker and fragile the older you get. So doctors, any closing remarks?
I think as women, we tend to take care of our community, and I think it's important for us to take care of ourselves and set an example for our own daughters of healthy living and healthy bone living, which is, I'm going to advocate for exercising and making it a normal part of your life.
And I would say that if you're over the age of 65, then consider getting the DEXA scan, talk to your primary care provider, see what lifestyle modifications you can do to try and get your bones as healthy as possible.
And it's never too late. So you can do all of these things. If you remember, the age that I cited, bone density starts to decrease, is 30s, people. So, it's never too early and it's never too late to start looking at your diet, your risk factors, and incorporating weight-bearing exercise into your daily routine.
So stay healthy, keep your bones strong, and then you will live a happier, healthier, and less broken life. No, just kidding. Let's say that again.
That's true. No, I like that.
Thanks again for listening to the Avaaz podcast. We are Dr. Jeethi, Dr. Madhu, Dr. Nab, Roop, your host. We're so glad you joined us today about the talk on osteoporosis. Please check into our Instagram site. We are at Avaaz_voice. You can follow us there. You can DM us with your questions, your suggestions, make a comment, and please share this episode with your friends, people of your own age group, people you think might be interested, because it's only by sharing this factual, scientific, medical information that we can make sure that false information is not spread. So share the news and please listen in regularly. Thanks for listening.